But we're going to kick things off today, helping you find relief from a particularly difficult form of headache. It's a type of headache that many people just can't escape. It keeps coming back over and over and over again. And the solution isn't found in a pill bottle. It comes from understanding the mechanics of something called cervicogenic headaches. Our subject matter expert today is Mary Hostetter, a physical therapist with Indiana Physical Therapy. Welcome to HealthCall Live.
Thank you. Thanks for having me.
Okay, so how do I recognize a cervicogenic headache as opposed to any other type of headache?
So it depends on where it is in the head. Most cervicogenic headaches occur in the back part of the skull, and it can kind of radiate up to the sides of the head. But most people complain of headaches in the back of their head. That's the number one complaint.
So the name cervicogenic tells us what about these headaches?
That they're cervical in nature, so that it's an issue in the upper cervical spine that's causing it, versus a migraine or a cluster headache or a sinus headache.
And so what do people tell you about how these headaches feel and feel different?
So a lot of times they feel it based on their posture. So by the end of the workday, they're like, man, my head is killing me, or a long car ride will trigger these types of headaches.
So that tells us that it's something to do with muscles and how you're holding your head and what's happening there. So here are a few factoids I found. 20% of people with chronic headaches have this type of headache. Whiplash is a leading cause of this headache, and that women are 4 times more likely than men to suffer these headaches. Why do you think that is?
I think women, we tend to hold our stress differently. Maybe, you know, with children, we're looking down more, holding babies, that kind of thing. Our posture maybe just be a bit different than men. But men definitely suffer from these too. So
let's dig into some of the anatomy here. So cervicogenic, you said that has to do with the upper cervical spine. So walk me through that. What's going on right there?
So your cervical spine basically is broken up into 3 different sections. So your upper cervical, C1, 2, 3, your mid-cervical, and then your lower cervical. So these headaches we're discussing are in reference to the upper 1, 2, and 3 cervical spine vertebral bodies, and the associated muscles around there.
So those are the vertebrae right immediately under the back of your head, right?
Yes.
First 3. So what's happening there that's causing these headaches?
So what's happening is there's a little bit of a biomechanical or movement dysfunction there, where you've lost full mobility in those upper cervical spines or vertebral bodies, which is thus reducing the ability for the muscles to move, and it's just triggering the headaches. That's what the pain is the lack of mobility in that upper cervical spine.
So the problem is in my neck, but I feel it in the side of my head.
Right.
What's going on there?
So let's just put the referred pain pattern. Like when you have a heart attack and your left arm hurts, there's nothing wrong with your left arm. That's just where the pain's being referred. Same with the headaches. Depending on where the headache's being referred, we know what part of the cervical spine is the cause.
People who come and see you, have they tried medications and it's not working?
Yeah, they've tried medications, over-the-counter analgesics. They've tried massage, and all short-term fixes for a long-term problem.
Yeah. So what kind of treatment seems to work best for these headaches?
We found a combination of physical therapy in combination with home exercises. So at Indiana Physical Therapy, we do a lot of manual therapy. So we'll get in there and do a little bit of hands-on work in the upper cervical spine, do some traction, do some light massage, calm down those irritated areas, and then send you home with stretches and some mobility work to do.
And we're going to get into that right after our commercial break in a few minutes. We're going to walk you through some of those procedures. So if you have these types of headaches, or even if you just want to learn more about relaxing your upper back and neck, we're going to walk you through some exercises that you can do at home that really aren't all that difficult once you understand what you need to be doing. I want to talk a little bit more about how you diagnose these headaches. When I come to see you, what are you looking at? What are you checking me out for?
So I start with a very good subjective. So I get a good idea of how long you've been having these headaches. in a 24-hour day, when do you notice the headaches? Do you wake up with it? Do you notice it on the car ride home? Do you notice it in the evening? And then as we're talking, I'm monitoring your posture. How are you sitting? Are you, like this, like majority of people are? No one has perfect posture.
Tell me what you mean by people on the radio couldn't see you sitting like this. So what did you do there?
So jutting the chin forward, rounding the shoulders forward, slumping down. Like, if you're talking on your phone, texting on your phone, driving, most people drive with we call it a forward head posture with anteriorly rounded shoulders. Most people, they present like that as we're complaining about headaches.
Okay, I'm going to call you out, listeners. Right now, at this very moment, where are your ears? Tell me what the relationship is.
So your ears should be right over your shoulders, so they shouldn't be in front of your shoulders. So you need to make sure that you bring your chin back, bring your ears back over you, bring those shoulders back and down.
I just saw our producer Heather kind of do a self-check there, like where are my ears at? So if you're listening at home and you found that your ears are not over your shoulders, so you're headed toward this problem potentially. How long do people typically have had these headaches by the time they see you? Is it something that comes and goes, or is
months and years they've had them? Yeah, and they don't really know what's going on. They've gone to their primary care physician thinking that they might be migraines, but they're not, because there's no associated issues with nausea or sensitivity to light. That's a different type of headache.
So these headaches feel different. And how would people describe these headaches as?
Like a throbbing, aching, nagging pain in the back of their head that will radiate up straight up or up to the side.
Do they tell you, and you told me earlier that think of a Rams helmet. Go through that process again.
Like the Rams football team, how they have the ram, how it kind of spirals up and around. That's kind of the cervicogenic pain pattern headache.
And now let's get to what you can do as a physical therapist to help me. So what's my first step in getting through all this?
So once we've established that it is a true cervicogenic headache, a lot of times, like I said, it's been a chronic issue. And our body, when we've been in a sense of pain for a long time, our body's fight or flight has kind of gotten off. So we've been in a state of fight and not flight. So we have become more tense. We've changed the way we breathe. We changed the way we hold ourselves. So what I teach people is just how to relax, calm down the system. The famous firefighter saying, everything gets better when the fire gets put out.
Right.
We help you put out the fire.
Okay, what's step one?
So step one is just checking in with how are you breathing. Everyone breathes correct because clearly you're still alive, but we change how we breathe when we're in pain. So instead of being good diaphragmatic breathers, good belly breathers, we become chest breathers. We use our accessory muscles, which again increase the tension up through the system. So I have people put one hand on their chest and one hand on their belly, and then I have them take a breath in and out through their nose, keep their mouth shut, and I say, only let your bottom hand rise.
So I want you doing this at home. Yeah. So get lay down, stand up, doesn't really
Wherever
matter.
You are.
One hand on the chest, one hand on your belly. And breathe.
Try to breathe in and out, only letting your bottom hand move.
Okay.
Yeah. So that initiates the parasympathetic system to help the body relax. And then what I do on top of that, once they have good diaphragmatic breathing going on, their body's more relaxed, I tell them how to start stretching and relaxing the upper cervical spine. And how you can do that is usually I have them rest their head against something. If they're laying down, I have them just rest on the pillow. If they're sitting, I have them rest their head against the back of, I have them put their chair up against the wall, have their head rest against the wall. And then I just teach them just to tuck their chin straight into their throat, like they're giving themselves a double chin. While keeping the shoulders relaxed.
Oh.
And you should automatically feel a stretch in the back of your neck.
You know, so we're doing this here in the studio, and automatically my shoulders went up.
Of course.
That's the wrong thing to do, right?
Yep.
Keep your shoulders down and push your chin in.
Yeah, because most people don't realize how much tension they keep up through that system anyway.
Yeah.
So just being more aware of how your body is positioned and holding itself really plays a good part in reducing the likelihood of these headaches reoccurring.
And how often do I need to be doing this little exercise? Give me some idea of how long do I hold that? What do I need to be doing?
So I tell people hold it for 10 seconds and try to do at least 10 of them, like a Kroger 10 for 10 special. So, okay. And I tell them throughout the day, you know, if you are heading into a stressful meeting or if you're driving into work, your headrest is the perfect height for these stretches. So rest your head against the headrest. And most people don't even realize how far forward their head is when they're in the car. Get those heads back. Get those heads up over those shoulders and try these chin tucks. To work, from work, throughout the day.
Okay, great. So if that's not getting it done for me, if I've got particularly stiff upper neck, what else can you help me with?
So what we do at Indiana Physical Therapy is we specialize in manual therapy. So I will feel around with my hands, the upper 1, 2, and 3 vertebral bodies, and see how they're moving. If one isn't moving properly on the other, I will address that with joint mobilizations.
What does that mean?
So what that means is I put my hands on a certain part of the spine and I just do what we call accessory motion. So I'm allowing those joints, so each vertebrae is connected to the other via these little facet joints. And so what I'm doing is I'm trying to mobilize and move those facet joints on the other to get something sticky unstuck. If you have a stiff knee, you know, and you move it around, bend it, extend it, it'll loosen up eventually. Same with the neck, only it's hard for people to do that on their own, so we assist with that.
Gotcha. So if I have this headache, it's already there, are these exercises going to relieve it, and how fast am I going to notice a difference?
Most of the time, it depends on how hypomobile you are. So how tight are you? I tell people I like them at least 50% better in 3 or 4 weeks. And a lot of that is just knowing or educating patients on being more aware of their body during the day and checking in with themselves throughout the day. You know, if you can avoid those trigger positions, then you're going to avoid a headache. So throughout the day, making sure the head is over the shoulders, doing those chin tuck stretches throughout the day is grossly going to reduce your risk of even getting a headache.
But if I have one of those headaches, will this chin tuck or the diaphragmatic breathing, will it interrupt that pain and help me get through it?
Oh, definitely. Definitely. It will definitely reduce the intensity, maybe reduce how long the frequency of that headache is, or even curb it altogether. The minute you start feeling something in there, do these stretches, lay down, do some relaxing breathing, and try to calm down that system before it flares up.
So this all sounds pretty simple once I understand it. How often am I going to be seeing you for treatment on trying to resolve these cervicogenic headaches?
So it depends. I like to see people about twice a week for a couple weeks, because what also we need to address is the whole posture issue. So with a forward head, rounded shoulders, right, that are leading to these headaches, we need to address the front part of the body, stretching out the pecs, getting those shoulders back, and we need to strengthen the muscles around the shoulder blades to allow you to have improved posture, getting those shoulders back, which allows the head to go back.
And that's something that's going to pay off for the rest of your life.
Definitely.
I mean, you will avoid a lot of potential pain and discomfort as you age if you can maintain that upper body strength. So, and people love to go to the gym and work their biceps and build up their chest, but you're telling me that we really need to pay attention to our back muscles.
Yes. Yeah. We call those the front part mirror muscles. They look good in the mirror, right? But we need to address what we call the scapular stabilizers, the rhomboids, the mid trap, the low trap, the lats. I mean, all those muscles that allow you to maintain that upright posture. So
give me a couple of quick exercises that I can do on that regard.
I love rows. Reverse flies.
Whoa. What's a reverse fly?
So a reverse fly is basically coming out into what we call abduction, squeezing those shoulder blades back to the spine, engaging those shoulder blades.
And do I need to be doing that with weights, or what do you recommend there?
It depends on how strong you are. I recommend no weights and just doing them seated. Then You can introduce gravity as a weight, so doing them laying down on your stomach with your arms hanging off the bed. You can do what we call ITY, so hanging off the bed, bringing your arms straight up in front of you like an I, then bringing your arms out at a 45 like a Y, and then arms straight out like a T.
Okay.
And that's a good workout because you're having to pull up against gravity. And most people don't realize how weak they are when they do that. And then you can hold cans of soup or cans of marinara sauce at home or bottles of wine, full bottles of wine, you know, so, and that'll introduce some weight for free.
Exercising with wine. That's,
right.
That's brilliant. I love that idea. Where else are you going to get that kind of information but here on HealthCall Live? Okay, real quick, whiplash, because it's something that happens to people. This is also a serious issue. Walk us through whiplash in the minute and a half we have left.
Okay, so what is whiplash? Whiplash is a gross stretch of the cervical spine, either forward and back or side to side from a car accident, from a football hit, something like that. And what happens is your body realizes there was trauma and it self-protects. And all these muscles, your upper traps, your levator, your scalenes, all these big muscles go into spasm to protect your spine. The number one complaint of people with whiplash is, I feel stiff. My neck is stiff. It's always stiff. No matter how much I stretch, no matter how many massages I get, no matter how much heat I put on it, I'm always stiff. That is because your body is bracing itself. It's not going to relax until it feels safe. So what we introduce is exercises to help reestablish the stability within the cervical spine.
Excellent. Okay. Folks, if you are interested and suffer these cervicogenic headaches and want to see what Mary was doing here in the studio, we videotape all these sessions, and I'll have it posted up on the HealthCall Live website. And also, I think Indiana Physical Therapy links to this as well. So you'll be able to see Mary walking you through these procedures. So I'll have that ready for you Monday, Tuesday. It'll be available, and I hope you'll come back and check it out then. And we'll also feature it on the Facebook page. Thanks so much, Mary.
Thank you for having me.
Indiana Physical Therapy has 18 locations all over Northeast Indiana and also now in the Indianapolis area as well. Mary works at the DeKalb Health Office in Auburn, but all of the IPT staff is trained to be able to help you with cervicogenic headaches. So you can find them online at Indiana Physical Therapy, indianapt.com. Indianapt.com is the web address. Make a call. You can schedule the appointment that you need to see a physical therapist at Indiana Physical Therapy.